Hey, good morning, West Salem staff and community. We're here today with our new district doctor, Dr. Nicki Hennessey, and I'm going to allow her an opportunity to introduce herself so we can get to know her a little bit better as we move forward into this school year.
Hi guys, again, Dr. Nicole Hennessey. I am a mom of two wonderful little kids. I have a soon-to-be second grader, Harper, who is in West Salem School District. And then I've got a little guy, he's 4, and he'll be in the school district next year through the 4K program. I am a pediatric hospitalist here at Gunderson. And between those two things, it gives me a pretty interesting perspective on kind of the pulse of what's going on in our community and in the health of our children, because I'm in the hospital with these kids every day, seeing what kind of the illnesses are that we're dealing with.
Well, thank you, Dr. Hennessey. And it's nice to know that, as both of us are parents of kids within our school district, obviously we want to have our kids in school, and, we want to make sure that we have the interest of not only our own children, but all of our children in the forefront of our decision-making processes as we go here. Obviously, right now, what's going on is we're hearing a lot about this Delta variant that's out there, and you being on the front lines, what can you share with us about the Delta variant and what you're seeing and how things are transpiring thus far?
So what we're seeing is that the Delta variant is significantly more contagious than our Alpha variant. In the Alpha variant, we considered that for every person infected, that person would infect 2 more people, which sounds like a large amount until we start talking about the Delta variant. And in the Delta variant, we say that for every person infected, they're going to probably infect between 8 and 9 other people. So the biggest thing is that it's significantly more contagious. It also is affecting children more than the Alpha variant, probably because of how contagious it is, and because unfortunately, our young children are not able to be vaccinated yet. So we are seeing a greater surge in our children. It's definitely here and in our community. When we are looking at what variant we're seeing in our community right now, it's almost all Delta variant. And as I'm sure a lot of you have seen in the news and such, a lot of the school districts in the area are already starting to really battle with outbreaks and such. And the communities are really seeing rising numbers. And unfortunately, the hospitals, because of that, are too. The COVID units are open again in both Gunderson and Mayo and are significantly full. So we definitely need to be aware of the virus and that it's here and that it's raising its evil head again.
So, Dr. Hennessey, you and I, along with our team here in the school district, have worked on our reopening plan as we prepare to have our kids back next Wednesday on September 1, and which is, a much better spot than we were in a year ago. So right now we're excited that our kids are coming back, and a year ago we were unsure of that. So as we've worked on the reopening plan and shared that with you, and you provided input. How do you feel about a reopening plan and the direction that the school district is going headed into the start of the school year?
I think we're really lucky like you said, in a much better place than we were in March of 2020, where we didn't know a lot. We know a lot more about COVID now. We know that we've got a vaccine, and it's a really good vaccine, and that it's working. It's important to remember that the COVID vaccine wasn't designed to stop all transmission of COVID. Its job is to hopefully stop transmission, but more importantly, decrease your symptoms so that you're having little or no symptoms and not ending up in the hospital and not ending up passing away from COVID. And we know it's doing a great job of that. We are seeing that it looks like we're going to start needing boosters for the vaccine so that we can keep our immunity up and continue to prevent the illness from spreading. Another thing that we know really well is that masks work. And importantly, they work not just for COVID, but for all bacteria and for all viruses. And so we can really do a good job of keeping our kids safe, physically healthy, mentally healthy, and in school by wearing our masks. When we look at all the organizations kind of across the area, or across the country, the CDC, the La Crosse Health Department, even my main medical body in the American Academy of Pediatrics, everybody agrees that the way to keep our kids physically healthy and in school, and therefore mentally healthy, is to stop the spread of illness, all illnesses, but specifically COVID. And we know that the biggest way we can do that is by using our mitigation measures, making sure we're vaccinated, making sure we're keeping our distances, and making sure we're masking. So in coordination with kind of what we've talked about and listening to the goals and desires of our community, we are going to highly, highly recommend masks to everybody. With the caveat of, if we start to see a huge rise in our community, a huge rise in our schools, or an outbreak in our schools, that we'll have to require masks, but encouraging people to really wear them as much as they can, so that we can keep COVID out of our schools and keep our numbers down. I guess kind of the cool part of this all is we as a community are really in control of all of this. And we as a school district are really in control of all of this. If we want our kids healthy and we want our kids in school and not doing any of the virtual school, we know how to do it. We vaccinate, we mask, and we don't come to school or to work when we're sick, which is a big culture change for a lot of people. But it's important for all viruses and all bacteria, not just COVID.
And I think, we can agree. And, you referenced the community survey that we sent out, and we had over 426 families within our district respond to that. The one thing that's over the overall arching that we can all agree upon is that we want our kids in our buildings. And, we're willing to go forward and start the school year with that optional masking, like we talked about, with recommending the fact that we do wear that. And as a district, our staff are going to model that within our buildings. Our adults are going to be masked to help model that for our families and for our children. And we're excited at the fact that we do get to open our doors in September 1. And we're not talking about starting our school year online. And our number one goal is to make sure that we get from September 1 to June 3rd and keep our doors open the whole time for our families and our students. And because we know how vitally important that being in school is for not only our children, but our community and our families as well. So, Dr. Hennessey, I really appreciate your thoughts and your input and your assistance as we've gone throughout the summer. And, we're excited at the fact that September 1 is closely, coming upon us, and we're getting ready for that. And there's no better place we'd rather have our kids. And I can speak for myself, and I'm sure you can speak to that as well, as having our kids in our buildings with our staff, because our staff is second to none. And we're so excited the fact that we get to welcome our kids back on September 1. So I just want to say thank you so much for all of your efforts and you helping us along the way to help to establish a plan going forward that, that is going to, take away some of those stresses and pressures on our families, to know that our kids are in school and being prepared that, we're going to do whatever it takes to keep our kids within our building. So thank you so much, Dr. Hennessey. I appreciate it.
Thank you.